Have you ever sat down to a simple meal and thought, this is healthy? This is safe, without realizing that one familiar food on your plate could be quietly pushing your kidneys toward irreversible damage? I'm Dr. Richard Hale, and I need you to hear this clearly, because what I'm about to say is not a theory, not an exaggeration, and not something you can afford to ignore, especially if you're over 60. Every year I meet patients who did everything right. They walked daily. They avoided junk food. They trusted common nutrition advice. And yet they still ended up sitting across from me asking the same devastating question. Doctor, how did my kidneys fail so fast? What shocked them, and what may shock you, is that the damage didn't come from alcohol or sugar or fast food. It came from something they ate regularly, believing it was good for them. Kidney damage doesn't announce itself with pain. It doesn't warn you when it's crossing the point of no return. By the time symptoms appear, more than 70% of kidney function may already be gone, and at that stage, no supplement, no diet trend, and no medication can fully undo what's been lost. But here's the reason you should keep listening, because this story does not end with fear, it ends with clarity. In the next few minutes, I'm going to show you exactly what most people get wrong, why it becomes dangerous with age, and most importantly, how a few precise changes can dramatically reduce the strain on your kidneys before it's too late. Stay with me, because what you learn today could determine whether your future is defined by independence or by a dialysis machine. As we get older, the body doesn't fail loudly. It slows down quietly, and nowhere is that more dangerous than in the kidneys. After the age of 60, kidney function naturally declines by about 1% every year. That may sound small, but year after year it adds up. By the time someone reaches their 70s, many people are operating with barely half the kidney capacity they had in their 40s, often without feeling a single warning sign. I've seen this play out countless times in real patients. People who feel fine, people who walk every day, people who eat what they believe is a clean and traditional diet. And yet beneath the surface, their kidneys are struggling to keep up with a workload they were never designed to handle at this stage of life. This is where sweet potatoes enter the story. Sweet potatoes are not a bad food. In fact, for younger adults with healthy kidneys, they can be a nutritious source of fiber and energy. The problem isn't the sweet potato itself. The problem is what happens when aging kidneys meet foods that are naturally high in potassium, and sweet potatoes are one of them. Just one medium sweet potato can contain over 500 milligrams of potassium. For a healthy 20 or 30-year-old, that's rarely an issue. Their kidneys clear excess potassium efficiently. But after 60, that clearance slows down, and potassium doesn't behave like sugar or fat. You don't feel it building up. You don't get an early warning. Potassium accumulates silently in the bloodstream, and when it reaches a critical level, it doesn't cause mild discomfort. It interferes with the electrical system of the heart. That's why elevated potassium is associated with heart rhythm disturbances, nighttime palpitations, sudden shortness of breath, and in severe cases, cardiac arrest. What makes this especially dangerous for older adults is the lack of early symptoms. The kidneys don't hurt. They don't send pain signals. In clinical practice, we often discover advanced kidney stress only after more than 70% of kidney function has already been lost. At that point, damage is difficult or impossible to reverse. I once worked with a 75-year-old patient who believed sweet potatoes were the healthiest food he could eat. He had replaced part of his regular meals with them, convinced he was protecting his heart and digestion. On paper, his lifestyle looked ideal. In reality, his blood tests told a different story. His potassium levels were consistently elevated, and his heart rhythm had begun to show subtle but dangerous irregularities long before he felt anything was wrong. This is why context matters more than reputation when it comes to food. Sweet potatoes aren't dangerous because they are toxic. They become dangerous when aging kidneys can no longer regulate minerals the way they once did. The same food that nourishes one body can overload another. From a biological perspective, think of the kidneys like a high-precision filtration system. When we're young, that filter works fast and efficiently. As we age, the filter becomes slower and more fragile. Pouring in minerals at the same rate we did decades earlier forces that system to operate under constant stress. Over time, that stress accelerates kidney scarring and raises cardiovascular risk. The most common mistake I see is not overeating junk food. It's over-trusting healthy foods without adjusting for age. Many older adults continue eating exactly as they did at 40, assuming the body will adapt. It doesn't. The rules change quietly, and those who don't adjust often pay the price years later. Now, to be clear, this does not mean sweet potatoes must be eliminated entirely. It means they must be eaten with awareness of timing, portion size preparation, and most importantly, what they are eaten with. Because while potassium alone is a challenge for aging kidneys, the real danger begins when sweet potatoes are combined with certain other foods that amplify potassium load even further. And this is where most people unknowingly cross the line. Because knowing that sweet potatoes are high in potassium is only the first layer of the problem. What truly accelerates kidney and heart risk comes from a pairing that millions of older adults believe is harmless, Shenjai beneficial, and consume regularly without a second thought. But understanding this alone isn't enough, because when sweet potatoes are paired with one common food, the strain on the kidneys can double overnight, and almost no one is warned about it. If sweet potatoes alone already challenge aging kidneys, the real danger begins when they're combined with something millions of older adults consume every single day: milk. This pairing looks innocent, comforting even. A warm sweet potato and a glass of milk before bed. Easy to digest, good for sleep, good for bones. That's what many people believe. But biologically, this combination can quietly overwhelm the kidneys in a way that few expect. Here's why. Sweet potatoes are rich in potassium. Milk is also a significant source of potassium. On their own, each may fall within what seems like a reasonable range, but together they stack. In one sitting, an older adult can easily consume more than 800 milligrams of potassium without realizing it. For younger kidneys, that excess is usually filtered out. For kidneys over 60, clearance is slower, less efficient, and far less forgiving. I once cared for a man in his early 70s who followed what he thought was a perfect evening routine. After dinner, he'd eat a small sweet potato to help digestion, then drink a glass of cold milk because he'd heard it supported sleep and bone health. He did this for years. He wasn't overweight. He walked daily. He rarely ate processed food. And yet he began waking at night with an odd sense of chest tightness, occasional heart pounding, shortness of breath that came and went. At first, he dismissed it as anxiety or age, but blood tests revealed the truth. His potassium levels were consistently elevated just below the emergency threshold. His heart rhythm showed subtle irregularities, nothing dramatic yet, but enough to raise serious concern. The cause wasn't a single bad habit. It was the combination he trusted the most. Potassium plays a crucial role in controlling heart rhythm. It helps regulate the electrical signals that tell the heart when to contract and relax. When potassium rises too high, those signals become unstable. The heart may beat too fast, too slow, or irregularly, especially during rest or sleep. That's why many people notice symptoms at night: palpitations, shallow breathing, a sudden feeling of unease that wakes them from sleep. And there's another layer most people don't realize. As we age, our ability to digest lactose, the sugar in milk, declines. When milk is consumed alongside a starchy food like sweet potatoes, fermentation in the gut can increase. This leads to bloating, abdominal pressure, and poor sleep quality. That pressure doesn't just stay in the gut. It affects breathing mechanics and cardiac workload, compounding stress on an already vulnerable system. From a clinical standpoint, this is what makes the sweet potato milk combination so deceptive. It doesn't cause immediate pain. It doesn't send dramatic warning signs. It creates chronic internal stress on the kidneys, the heart, and the digestive system day after day. And because it feels healthy, people rarely question it. Now, does this mean milk is inherently bad? No. And it doesn't mean sweet potatoes are forbidden. The issue is timing, pairing, and age-related physiology. Older adults simply cannot process stacked potassium loads the way they once did. What nourishes at 40 can destabilize at 70. This is why dietary advice must change with age. Bone health matters, sleep matters, but kidney and heart stability matter just as much. When kidneys struggle to excrete excess potassium, the heart becomes the silent casualty. And by the time someone connects nighttime symptoms to diet, damage may already be underway. The solution isn't extreme restriction, it's strategic separation. Avoid consuming high potassium foods together in the same meal. Be cautious with evening intake when kidney filtration naturally slows. And most importantly, stop assuming that foods labeled healthy are universally safe at every stage of life. Because once you understand how easily potassium can accumulate, You begin to see that milk isn't the only partner that turns sweet potatoes into a problem. But knowing this still isn't enough, because there's another pairing far more common, deeply rooted in tradition, that can push aging kidneys to the point of irreversible damage without causing pain at all. If the combination of sweet potatoes and milk quietly overloads potassium, the next pairing is even more dangerous, not because it feels dramatic, but because it feels normal. Sweet potatoes eaten with salty foods, pickled vegetables, fermented sauces, salted condiments passed down through decades of habit. For many older adults, this is comfort food, familiar, satisfying, and deeply underestimated. From a biological standpoint, this combination places aging kidneys in an impossible position. Salty foods are high in sodium. When sodium floods the bloodstream, the kidneys are forced into emergency mode. Their job becomes urgent: remove excess sodium to stabilize blood pressure and fluid balance. But here's the hidden problem: sodium doesn't leave alone. To excrete sodium, the kidneys must also pull potassium along with it. Now remember what we've already established. Sweet potatoes are potassium-rich. When potassium intake is high and sodium intake spikes at the same time, the kidneys are pushed to filter aggressively under pressure and without rest. For a young, resilient kidney, this may be tolerable. For kidneys over 60, it is a direct path toward structural damage. I once treated an older woman who followed a diet she believed was modest and traditional. Steamed sweet potatoes for energy, a small portion of pickled vegetables for taste. Nothing processed, nothing excessive. Yet over time, her kidney function declined faster than expected. Blood pressure became harder to control. Swelling in the ankles appeared. She felt tired without knowing why. Imaging later revealed early scarring of the kidney's filtering units, the glomeruli damage that cannot be reversed. This is how kidney injury often happens in real life. Not through extreme behavior, but through repeated small stresses, day after day, meal after meal. Sodium forces the kidneys to work harder. Potassium increases the load they must manage. Together, they create a constant high-pressure environment inside microscopic blood vessels that were never meant to endure it long-term. Scientifically, this process is known as glomerular hyperfiltration. At first, it looks like the kidneys are doing their job well. Filtration rates may even appear normal. But behind the scenes, the filters are stretching, thinning, and slowly hardening. Over time, this leads to glomerulosclerosis, permanent scarring that reduces kidney capacity forever. What makes this pairing especially dangerous is how deeply rooted it is in habit. Many older adults prefer sweet flavors balanced with something salty. It feels complete, it feels comforting, and because the effects are delayed, the connection is rarely made. By the time lab values shift, the damage has already begun. To visualize this, imagine an old household plumbing system. The pipes are narrow and worn from decades of use. Now imagine turning on a high-pressure faucet every day. At first, the water still flows. Nothing bursts immediately. But slowly, the pipes weaken, warp, and crack. That's exactly what happens inside aging kidneys under repeated sodium-potassium stress. The solution is not to eliminate flavor or tradition. It's to change how pressure is applied. Reducing salty accompaniments when eating potassium-rich foods gives the kidneys room to breathe. Separating these foods into different meals lowers filtration strain. Even modest sodium reduction can significantly decrease kidney workload in older adults. This is especially critical for those with high blood pressure, diabetes, or early kidney disease conditions that already narrow the margin of safety. In these individuals, sodium doesn't just raise blood pressure. It accelerates kidney decline by amplifying potassium retention and vascular stress. What's most tragic is that none of this causes immediate pain. No sharp warning, no clear signal. The kidneys suffer quietly until one day the diagnosis arrives and options are suddenly limited. By now, you may be realizing that sweet potatoes are not the enemy. The enemy is pairing them in ways that force aging kidneys to fight battles they can no longer win. Milk strains them through potassium stacking. Salty foods strain them through pressure and forced filtration. But there is still one combination left, one that almost no one suspects. It doesn't cause instant discomfort. It doesn't raise alarms right away. And yet in clinical reality, it may be the most dangerous pairing of all. But understanding this still isn't enough, because there is one final combination, rarely discussed, deeply underestimated, that can silently tip aging kidneys from stress into true crisis. After understanding how milk stacks potassium and how salty foods force aging kidneys into constant overdrive, there is one final pairing that almost never raises suspicion. It doesn't feel heavy, it doesn't taste extreme, and it doesn't cause immediate pain. That's exactly why it's the most dangerous of all sweet potatoes eaten with persimmons. For many people, this combination feels harmless, even wholesome. A warm sweet potato to settle the stomach, followed by a ripe persimmon for something refreshing. It's a habit passed down through generations. Familiar, seasonal, comforting. But biologically, this pairing creates a chain reaction that can quietly spiral into serious digestive and kidney stress, especially in older adults. Here's what's happening beneath the surface. Sweet potatoes contain pectin, a type of soluble fiber. Persimmons, particularly ripe or dried ones, are rich in tannins. On their own, neither compound is dangerous. But when pectin and tannins meet in the acidic environment of the stomach, they bind tightly together. Over time, this binding can form a hard glue-like mass known clinically as a gastric bezoar. This mass doesn't dissolve easily. It doesn't pass quickly. It sits in the stomach, interfering with digestion, slowing gastric emptying, and creating constant internal pressure. People may notice bloating, nausea, heaviness, or loss of appetite, but often dismiss it as normal aging or indigestion. I've seen patients who live with these symptoms for months without realizing what was happening. One older gentleman came in complaining of persistent fatigue and dizziness. He had no obvious dietary excesses, but when we dug deeper, a simple habit emerged: sweet potatoes, followed by persimmons several times a week. Imaging later revealed a dense gastric mass. His digestion had slowed to a crawl, and toxins from fermenting food were steadily leaking into his bloodstream. This is where the kidneys enter the crisis stage. When digestion is impaired and food stagnates, fermentation increases. Harmful byproducts such as ammonia and other nitrogenous toxins are absorbed into the blood. These toxins don't stay in the gut. They are filtered by the kidneys. For aging kidneys already burdened by potassium management and reduced filtration capacity, this extra toxic load can be overwhelming. Clinical observations show that older adults with impaired digestion often experience sudden spikes in kidney stress markers. Fatigue worsens, mental clarity declines, fluid balance becomes unstable. In vulnerable individuals, this can trigger acute kidney injury, especially when combined with medications that retain potassium, such as certain blood pressure or heart drugs. And that's what makes this pairing uniquely dangerous. It doesn't just strain one system, it traps digestion, increases toxin production, disrupts electrolyte balance, and forces the kidneys to compensate all at once. No sharp pain, no immediate alarm, just a quiet escalation toward a breaking point. What's especially concerning is how rarely this risk is discussed. Most people are warned about sugar, fat, or salt. Almost no one is warned about food interactions, how two healthy foods can become harmful when combined, particularly later in life. The solution here is simple but critical. Sweet potatoes and persimmons should never be eaten together, especially within the same meal or within a few hours of each other. Giving the digestive system time to clear one before introducing the other dramatically reduces the risk of binding and toxin buildup. For older adults, spacing matters just as much as portion size. Avoiding this pairing alone has helped many patients stabilize digestion, reduce toxin load, and ease kidney strain without medication, supplements, or drastic dietary changes. Sometimes prevention isn't about adding something new. It's about separating what never should have met in the first place. And this brings us to the most important realization of all. Sweet potatoes are not the enemy. Persimmons are not the enemy. The danger lies in how we eat as our bodies change without adjusting for the limits of aging organs that no longer forgive mistakes the way they once did. But understanding this still isn't enough, because there is one final factor often overlooked, rarely discussed, that can determine whether your kidneys stabilize or whether dialysis becomes part of your future. Before we end today, I want you to pause for just a moment and remember this: protecting your kidneys after 60 is not about fear restriction or giving up the foods you love. It's about awareness. It's about making small, intelligent choices early before your body is forced to pay a heavy price later. If you've been eating sweet potatoes thinking you were doing something good for your health, you're not wrong. You just needed the right knowledge to use them safely. If this video helped you see your daily meals differently, I strongly encourage you to save this video. Not for me, but for yourself. There may come a day when you or someone you love needs this reminder, and having it one tap away could make a real difference. And if you care about protecting your kidneys, your heart, and your independence as you age, make sure you subscribe to this channel. Every week we share clear, practical medical knowledge, no hype, no confusion, focused on kidney health, aging safely, and living well for the long term. You don't need expensive treatments to protect your kidneys. You don't need extreme diets. What you need is understanding, consistency, and the willingness to listen to your body before it starts to shout. Many people only change after dialysis becomes a reality, but you are watching this now, which means you still have time. Time to choose wisely. Time to slow down damage. Time to protect the organs that have silently protected you your entire life. Thank you for spending these minutes with me today. Your health matters. Your future matters. And as long as you're here, we'll continue walking this path together, one informed choice at a time.